Hi everyone, my name's Emma O'Neill. I'm a doctor working in palliative care in the UK, and I'm here to present the work that was done at Leeds Medical School on introducing planetary health teaching into the curricula here. So, I approached Leeds Medical School asking to include teaching on planetary health and was allocated 2 afternoons within the population health module in year 2. I worked on producing teaching for these afternoons with supervision from Dr. Gemma Ashwell, who was module lead. Dr. Francesca Douglas, who was at the time a 5th year medical student, helped create some pre and post-course questionnaires. This teaching took an ecosystem transformation approach as laid out by the Planetary Health Alliance. Therefore, the health impacts were discussed in terms of which ecosystem transformation led to these impacts. It was important to ensure the concepts of justice and injustice and inequalities were highlighted throughout the teaching. The intended learning outcomes are shown here, and we'll come back to these in a second. So how was the teaching delivered? Well, it was first delivered in 2021, so it's entirely virtual because of the pandemic. The first lecture introduced planetary health and discussed aspects, including the drivers behind this environmental decline. The students then had some self-directed learning time in which I created 2 interactive e-learning packs, one on climate change and health and one on ecosystem transformation and health, which centered around biodiversity loss and the effects of this on health. And it also talked about agriculture and our food systems, our freshwater and ocean ecosystems, along with the role that healthcare has on this environmental decline. The packs were really interactive with audios over some sections, videos, interactive graphs, MCQs dotted throughout, and case studies to help aid connection of this knowledge with practical clinical skills. The final pre-recorded lecture was on solutions for planetary health, encompassing concepts of justice and solutions such as decarbonisation, and highlighting the co-benefits to human health that these solutions have. So if we move on now to talk about the live Q&A. The live Q&A was a real highlight of the teaching. Panelists included Dr. Sam Myers of the Planetary Health Alliance and Dr. Jane Goodall, DBE, a world-renowned conservationist. And the students found this really engaging and motivating. So I'd like us to move on now to talk about the responses to the pre and post course questionnaires with a 33 and 21% response rate respectively. Only 10% of respondents had any prior teaching on climate change or planetary health. We can see from these graphs that there are significant improvements in knowledge of respondents, with a 68% increase in respondents rating their awareness of the concept of planetary health as mostly or exceedingly aware. And there were similar increases in the awareness of the impact of climate change on health. Our results suggest a lack of prior knowledge on the contribution of healthcare to climate change. When asked to what extent are you aware of the contribution healthcare makes to climate change, prior to the course, 48% had very little awareness and only 6% were mostly aware. Following the course, there was a 62% increase in students rating this question mostly or exceedingly aware. And there were similar increases in the awareness of the impact of biodiversity loss on health. So when asked to rate the question, I feel that people are suffering from the health consequences of the climate and ecological crisis now, 41% of respondents scored very much pre-course, and this increased to 73% of respondents following the course. They were also asked to rate the statement, I feel that it is in a doctor's role to advocate for change to reverse the climate and ecological crisis. 19% of students responded as 5 or very much prior to the course, and this increased to 51.8% following the course, with 91% scoring at a 4 or a 5 following the course. And finally, 91% also felt that it should be part of every medical curricula. So here are some of the comments from the students on the teaching, which was really encouraging to hear. Especially the one that says we need to promote this to other medical schools now. So this teaching has run for its 2nd time in 2022, and whilst the results discussed relate to the 2021 teaching, I thought it would be nice to finish with these visual minutes taken in the live Q&A this year, and you can see the panelists listed here. It really helps to highlight the breadth and scope of knowledge that we need to convey to our students. So the need for the teaching is urgent. So the sooner that we implement teaching on planetary health within medical curricula, the better it'll be for us, for our patients, and for our planet. Thank you.